OurNews. I'm your host, Cwayita Zweni. You are what you eat, so they say. We eat so much without knowing even of the impact that the food we eat might have on our bodies. Tonight we speak to a young man, Melikhaya Kene, who is a patient of chronic renal failure, who found himself at the age of 27 or even 26 that he has this sickness. A warm welcome to you, Melikhaya.
Hello, Clive. Njani?
Siyaphila, Nkosi njani?
Siyaphila ngathi akukhona inkosi.
Kasixelele Kameza about your renal failure. How did you come about knowing that unale chronic condition?
All right. Indlela eyaqala ngayo ke le condition ngokwakum ndaqala ngokudumba inyawo. It was on a Sunday ndivele enkonzweni. The funny part about this is that zange ndivuke inyawo zam zidumbile, but xa ndibuya ecaweni ndabuya inyawo zam zidumbile. But ithatha light loo nto because ndandicinga uba mhlawumbi into nje, kodwa ke kwathiwa into enodumba kwenyawo phakathi has to do with the organs, so I should get it checked out. Ndaya kwagqirha ke, xa kusenziwa itest kagqirha kwafumaniseka ukuba ndine-nephrotic syndrome. Kwaku-2018 ke ngoko. Okay. Now, ngokwenantsika ngokwe-kidney disease ne, kukho istages eziyi-5. Ndasuka ke mna ke from stage 1 ndazibhaqa sendiku-stage 5. Stage 1 being i-nephrotic syndrome, and then stage 5 is i-kidney failure. Isizathu ke soko kum, I was not responding to i-treatment endandiyi-prescribe-jelwe ngugqirha endandihamba kuye ngelo xesha. Kwanyanzeleka uba ndifumane enye i-treatment abathi xa bebizayo zii-immune suppressors. Kwakwingxaki ke kunye ne-medical aid, because i-medical aid apparently ke zaziduru kakhulu ezi pilisi for baveske nje bandinike zona. So ugqirha had to motivate over why is he changing the treatment ebendiyisebenzisa kuqala. So ke kwakho ingxaki ke ngoku kuloo nto yokuba funeke nditshintshe i-treatment. Ugqirha wasokolisa umotiveyitha ne-medical aid yasokolisa uphendula up until ndade ndazifumana ke ngoku ndiku-stage 5, which is i-kidney failure. Hayi andifuna uxoka sisi. I-support ndiyifumana kakhulu from ii-peers zam. I-support ndiqala ke ndiyifumane from the family members isikakhulu, nee-friends ke zam nabantu abaclose kum, phofu nabantu abangandaziyo close, abantu abandazi nje but bayandisapota kakhulu kolu hambo ndikulo le-kidney failure. And I think yinto encedisa kakhulu le yokokuba abantu bakusapote xa uzibhaqa usengxakini efana nale endikuyo.
And back to the topic, with you finding out that you have this condition, what was intoni ezibangele le condition?
All right. Now, xa ubuza i-condition ke ndidinga clarity, ubuza nge-kidney failure, right?
Yes, ndibuza nge-kidney failure but.
All right, because remember, ukudiagnoswa kwam ne, I was not diagnosed with kidney failure.
Yes.
I was diagnosed with nephrotic syndrome, which later developed into kidney failure. Now, so i-cause ke ye-kidney failure yam was nephrotic syndrome. Because nephrotic syndrome ukuba damaged kwezinso ngendlela ezethiwa damaged ngayo izinso zibangela okokuba kulikishe iprotein. Le protein ithi xa ilikisha ke ngoku ifike idumbise inyawo, kubanye abantu idumbise ubuso. So ndafunyaniswa ngelo hlobo mna ukuba ndine-nephrotic syndrome ke ngoko, which later developed to kidney failure. So i-cause ye-kidney failure leyo was i-nephrotic syndrome.
Okay. And then in nephrotic syndrome, if you can just tell us about it. Inoba yenziwa yintoni to a young person ofana nawe?
Mna personally indifumene i-nephrotic syndrome ndisenza i-second year e-university. Ngoko ke i-lifestyle yase-res okokuqala nokutya kutyiwa e-res ayiko kutya eku-health. Sitya nje into ekhawulezileyo because soloko sibhizi sifuna ujonga incwadi. And ke enye into ebiyingxaki kum kakhulu into yokuba bendingakwazi ufunda emini, so bekufuneka ndi-cross night ukuze ndikwazi ukufunda kakuhle. Now the only way ke ngoku bendikwazi ukukhipha up nencwadi xa ndi-cross nightile kukusebenzisa i-energy drinks. So i-cause ke yokuqala kum ibiyi-high intake ye-caffeine because bendisebenzisa kakhulu i-energy drinks ukuze ndikwazi ukukhopha emini nasebusuku ndingalali ndikwazi ukufunda incwadi. Secondly, bendithanda ukuba ne-back pains, which is one of the symptoms ye-kidney disease, but ke ndandingayazi ngoko. Ezi back pains ke zaziba lapha kwi-waist area apha esinqeni. So ndandisebenzisa i-pain killers kunye ne-heat lotion ezine-anti-inflammatory. Oogqirha ke bathi into ezina-anti-inflammatory iyakhoza nazo i-damaged kwi-kidneys. So mna i-causes zimbini kum, i-caffeine kwakunye nosebenzisa ezi pain killers nezi heat lotion endithetha ngazo.
Okay, Melikhaya, thank you so much. We are going to cross now to our second guest. We do have Dr. Bayeni on as well, who will be telling us or more of validating what Melikhaya has been telling us as well, because this is a formal diagnosis that Melikhaya has had. But before we cross over to Dr. Bayeni, to the ad break.
Yeah guys, yeah siphila ke kulo maxesha nzima amaxesha e-COVID. And umongameli usanokubhengeza ukuba siku-level 1 and ukufika kwethu ku-level 1 akuthethi ukuba i-COVID-19 okanye icorona iphelile, isaphakathi kwethu sisaphila nayo. Ithi loo nto leyo it's not business as usual nangoku. Kusafuneka silandele imiqathango. Kule mihla ke siphila kuyo i-live streaming yemingcwabo ndiyacinga nam uba yenye yezinto ekumeleyo ukuba wonke umntu okanye wonke ubani abe uyayenza. Iyanceda ke kwelinye icala ukuba ufuna ukuthoba iindleko zomngcwabo. Ukunwenwa kwe-COVID ke ukubalula nje izinto ezimbalwa ke phakathi kwezinye. Kodwa ke don't despair, ungawari, because ke abakwa OurNews online bayaqinisekisa ukuba baniphathela ke le nkonzo, and ke eyona nto baqinisekisa ngayo ukuba yinkonzo le efikelelekayo, kodwa iyafikeleleka. Yes, ungayibona wena ufikeleleka ucinga baza kunika nje baza kugqwagqwa. Iyafikeleleka kodwa ke ikwinqanaba eliphezulu kakhulu. Amaxabiso abo aqala kancinci from 2,450 qha. 2,450 qha. Kufikelela kulula guys.
Yes, it's on.
Welcome back to the show. This is the chat of OurNews. I am your host, Cwayita Zweni. Now, we did mention before the ad break that we do have Dr. Bayeni on the show with us to validate what Melikhaya has told us before the ad break. Welcome to the show, Doc.
Thank you very much. Thank you for having me. And it's good to be part of this very innovative, entertaining platform as well. Thank you.
So, Doc, we have Melikhaya, a 27-year-old who is living with chronic renal failure at the moment. It's not a nice thing to have for any young person. What can you share with us with regards to the sickness or the condition that Melikhaya has on a medical perspective now?
Well, I think, thank you very much. And it was a great narrative in terms of the way Melikhaya had explained how he progressed, even initially from nephrotic syndrome to actual the end stage renal failure. I must say, sometimes we always try and be careful when we deal with patients and say patients are not textbooks. We must deal with them individually as they present. But I must say, as he was presenting from the symptoms to the possible causes, okay, with textbook so indeed, it is the reality, but when we talk of the renal failure on its own, one, we always have a statement that it doesn't happen overnight. It's a gradual diagnosis, or it's a gradual disease, which on its own is an end stage when we talk of renal failure. Because at the time, maybe if we can just bring on board our viewers, because what we're talking about here, it's when your kidneys have lost an ability to remove waste or even balance fluids because in actual fact, your zona kidneys by their nature, is to do those two things mainly: to remove waste from your blood and also to balance the fluids in the body. So inability, your ability to do that, and that's when we find ourselves dealing with what we refer to as a kidney failure. And sometimes there are two forms of presentation kuyo. Iba khona ke le iba what we refer to as acute renal failure, where it's mainly a sudden onset to filter the waste from the body, from the blood. And then ibe khona, which is where he would mainly fall under the one we refer to as chronic, because it's referred to as a long-standing or progressive disease, which therefore then leads to the actual end renal failure. So he would then, as he has explained, we were just saying now it's a nephrotic syndrome, but already the damage or the injury was to the kidney. But over time, that's when it became even difficult for a medication that he was put on to be actually responsive or react or deal with the condition he was in. So those are the two presentations I know. Sometimes it can present as an acute format. Acute mainly you'll find that for any ICU, but because there is also that prolonged hospital stay, which is another risk factor, would develop that renal failure. So that's why it will fall under acute, because you did not necessarily have a renal failure problem, a kidney problem. You had other things. But because really ICU, you are not mobile, we stagnant, and that will keep on pumping you with other medications for whatever reason. So you end up being at a risk of exactly developing acute renal failure as compared to which is the chronic one. So that's why sometimes we differentiate in terms of the acute and also the chronic. And interestingly as well, in the presenting I'm not tired because it's true, but any risk factors is mentioned, Ilando, which were limited analgesia, especially your ibuprofen and aspirin. And that's exactly what has happened to him, that he was exposed and using a lot of that, and with time, it ended up damaging or causing harm to kidneys.
Okay, Doc, leading up to my second question now, which other types of foods do we think might cause this type of a condition for anyone, or even anyone who could be watching us now?
Well, maybe before we even get to food itself, because we'll probably just summarize it as a lifestyle. What we do advise or do educate about with in terms of the risk factors that go with renal failure. One, if the older generation, some literature talks about 60 years of age and above, it's a risk factor. Obviously, we have now here a young man that has also presented. So it's just one of the risk factors, the age. But also those that have got a history of having been born with what we refer to as a low birth weight, prematurity sometimes, but mainly low birth weight, as well as abantu that will have a family history where uzawutsho uba hayi utatomkhulu wayengnayo ingxaki ezintso or umama okanye utata when there is a family history. Kuthiwa ke xa kuthethwa, those three are the main strong risks eziye zibe khona when it comes to abantu being in a risk of getting kidney failure. But also, we have got medical conditions that will also predispose you. Mainly those three categories will be your diabetes, your hypertension, as well as if you've got a cardiovascular or a heart disease. So that will also bring you, predispose you. But we also have what we refer to as your lifestyle. The lifestyle care will talk to the issues of smoking, issues of obesity, and that's where your question was in terms of food. Because we might not be specific now, but you know the food that we intake will lead us to having obesity, and indirectly obesity as well might put you in a risk over and above the actual specific food. So a lifestyle in terms of smoking, in terms of the food and the diets we take, that leads us into ending up in obese, also do contribute to that. And as well, as part of the lifestyle, analgesia, because you tell yourself, no, whenever I'm in pain, I must take something. So that's also part of the lifestyle in terms of the contributing factors. So those are the main things that will make you to be at a risk of developing this this kidney disease and damage that results in an end failure and the condition we are talking about today, which is kidney failure.
Okay, Doc, thank you so much for that answer. And just before we close, and what can we tell people who are living with this condition in terms of indlela zokuyimanaja, things that they might not even hear in consultation with their doctors? Bangayimanaja kanjani le condition abantu abasebenayo, and for those who have not been diagnosed okanye abangekaboni signs or symptoms, what can they do to try and prevent this?
Well, I think on our side, maybe the fact that Amandulate now has already listened and heard that there are risk factors, that could be a starting point, because we do indicate that there are those risk factors. So we would advise Amandulate to look out in terms of especially the disease of the lifestyle, that when we start controlling and being careful of what we take and how we behave, could go a long way. But importantly, I always say when we're doing health talk, one of the things that especially as Africans, we are very much, I don't want to say shy to do, but very much limited in terms of doing, is this our conversation about the family history? Because we hardly talk about what has been there in the family. Who has got illnesses and what type of illnesses are those. So sometimes we end up having to lack in terms of our family history. As a result, so we would want to encourage families and especially young people to start these conversations to say, what are the medical conditions as co-appending? Who do we think might have had, including your cancers, including your disease of the lifestyle, as well as your communicable diseases, so that we start understanding family tree, because it has a lot of bearing in terms of your risks going forward. But obviously, we do encourage abantu bethu to say, suspect you might be having symptoms, masiyeke nalento of delaying healthcare assessment and assistance. So I always say the healthcare seeking behavior is one of the things that we need to work on. When there are things that are happening, just maybe as a by the way thing, because when we talk of kidney failures, as many as the symptoms abantu bethu would have presented with include frequency or noticing blood emchameni, as well as probably some foamy urine. So of months ignores such symptoms, as well as don't consult and doesn't bother, instead whereas a damage is being done even more on the kidneys. So abantu bethu must just improve on their healthcare seeking behaviors. Abantu bethu must just know and start the conversations of understanding family histories. And also we would want abantu bethu to review and consider in terms of the lifestyle, because in actual fact now the most burden in health is what we refer to as disease of the lifestyle. And also maybe just to caution and teach abantu bethu, when it comes to the renal failure, especially the end stage, the challenge with it is that there are three modalities to treat it. One, or the main one, is to do a kidney transplant, which we unfortunately know it's a very difficult procedure to go through. Not because there are no surgeons to do it or hospitals to do it, but unfortunately, in the South African population, there's probably less than 1% yabantu who are organ donors. So xa usithi ufuna a kidney, you will struggle because kwalapha efamilini yakho, no one has ever bothered to volunteer or avail themselves to be blood donors, to be organ donors. So that on its own creates a challenge. As it is now, I know the 2019 report had even said there's about 4,300 people who are waiting for a kidney in South Africa alone. And at some stage in 2013, I think they were saying an estimated cost of the procedure is about 100,000. So those on its own will tell you, a ultimate procedure might be very difficult to get, even if you wanted to, because of these dynamics, especially in South Africa. So it's very imperative abantu bethu to try into bazigade bangade bafike kulo level whereby they would need into mababe kanti undergo such procedures which they cannot even be able to access even if sebefuna.
Okay, thank you so much, Doc. Now back to Melikhaya. Melikhaya, are you in any position of getting a donor to assist you, an organ donor, or is there a potential one maybe?
Yes, Sisi. Fortunately, I do have a potential donor, which is my cousin. Emva kwexesha elide ndiyayivuya le nto uDoc eyivezile kunzima kakhulu ukufumana idona and xa sendiyifumene le platform ndiyacela nje ukuaphila ebantwini ngoba bancede abantu abagula nge-renal failure, more especially abantu abazi-relatives zabo, because kuthiwa eyona kidney elastayo from a transplant kwi-kidney oyifumana kwi-relative yakho. So abantu abangoyiki, more especially thina sizwe esimnyama siyoyika kakhulu udonate ii-organs. Sixolele uriska uba siluze abantu bethu sibathanda kuba thina sonqena ukudonata ngee-organs. Mhlawumbi ke it has a lot to do nento yokuba abantu abekho educated ngezi zinto. Kuyafuneka zibe khona ii-programs ezizawufundisa abantu kakhulu malunga nezi zifo ezikhoyo ne-kidney transplant and all that stuff, so that abantu bayeke ukuhambisa i-false information.
Yes.
Ngokwe-potential donor ke sisindinayo and sendiyiqalela i-process yokufumana i-transplant because
Okay. And according to our culture, Doc, we do have people according to their cultures, and in actual fact, abathanda ukuthi no ukunikeza nge-organs zakho akuyonto i-right culturally. How do we begin, or where do we even begin educating people on organ donor, organ donating, to be exact, because some of us sign up for it. However, we sibambalo and abantu bethu don't want to be part of that. Where do we even begin educating? Because in this space as the media, I believe that we should be playing a role in educating our people. Now, in the last 2 minutes of the show, can you just tell us about that, Doc?
Well, I'll even be brief and be faster than 2 minutes. Our starting point is with Lebu, our director and producer for today, to say that maybe we should come back and talk purely about organ donation, where we could even probably ask and invite people that have got religious perspectives to share, and then on the medical side, we'll then be sharing the benefits thereof. As Melikhaya has indicated that you cannot wish for a kidney to come overseas. When here last week ubusemsebenzini wakho wenu nithi ningamantondoni niba 100 phayana, but none of them wants to give you a kidney. Now you must wait for a kidney from someone who doesn't even know you. So those are the conversations we need to then start having upper west platforms also. But importantly for us, I think the issue and the value of us continuing to educate abantu bethu ndoba izinto asafani kuqala. Yes, we might have been brought up by abantu who have imposed their own traditional or even religious beliefs, looking at how things were before. But now, since Fumana yet disease of the lifestyle. Like I said, the literature was saying renal failure should be common to over 60. But here we are talking to Melikhaya, who's 20-something, who is saying the operation. So we need to start changing the mindset of Bandu, both in the religious, traditional, and family sector, to say it's fine what you were told, however, silapango. How's Osmamela about what is new, what is happening now, so that perception could be changed a bit. So I think we could come back and start talking and creating that dialogue and starting those mindset changes in terms of the organ donation.
Okay. Thank you so much, Doc. And this Babukeli, those were our two guests, Melikhaya Kene and Dr. Bayeni, are letting us know about renal failure and most importantly, organ donating. That will be it from us tonight. Have a good night.
Right.